Boy, this is going to be a tough question.
How will my retirement
Should I
account be
consult a
affected?
specialist? Filing for bankruptcy?
George, good evening. Go ahead.
What are some heat pump
My
advantages?
identity has been stolen.
Good evening, I'm Gary Sieber. Welcome once again to Ask an Expert, WNIT's live program that allows you to call in, ask a question, and get some help from our highly trained professionals who join us in the studio. On tonight's Ask an Expert, we'll talk about caring for an aging parent. Wow, that's a big subject. We'll talk about hard questions that you'll have to ask your parent or parents, legal matters that you might need to consider, and what local resources are available to help you. Joining us for the conversation tonight here in the Gainey studio are attorney Eric Marshall. He is an elder law expert here in South Bend. Barbara Dyskowski of Alzheimer's and Dementia Services, a division of Real Services. Dale Carter of Northwoods Village at Edison Lakes, an assisted living memory care facility. And Donna Billy Weiler from Cass County Council on Aging. You know, a child born in the year 2011, just a couple of years ago, according to statistics, can now expect to live some 78.7 years. That's about 30 years longer than a child that was born in the year 1900. And since the turn of the century, since 1900, the percentage of Americans at 65 years and older has more than tripled the percentage, and the actual number has increased from over 13 times, from 3.1 million to 41.4 million today. So those facts alone will tell you that people are living a lot longer than they used to. The bigger question is, are we living better? And how are we taking care of our parents and our grandparents? And are people finding what they need to make the decisions that they have to make? It's very difficult decisions to make. We sure hope that you'll join our program tonight. And we have four great people on to talk about all these issues. If you're a child dealing with an aging parent, or if you're a spouse taking care of a spouse, whatever it might be, if you're taking care of an aging loved one, you can give us a call tonight if you have questions, legal questions, social questions, even just having a conversation with your parent. We hope you'll call. The number's on the screen. We'll put you on the air if we can get back to you and select your call so you'll hear your voice over the air. If you would prefer rather to not have your voice on the air, you can always send us an email at the address that you see on the screen. We'll try to get to those questions, at least as many as we can, during the course of the show. So call us. We'd love to have you on the program. Eric, let me start with you as we work our way from one end of the table to the other until we get our callers lined up. You deal with elder law. You handle obviously a lot of issues as an attorney. What's the number one issue that the number one question that you get from most of the people who are contacting you about their aging parents?
Well, it first starts out with my mom's in a nursing facility. What do I do next? And so the first thing I'll do is ask them, do you have a power of attorney? Do you have the healthcare consent form? Do you have a living will? And a lot of times they don't, and I'm surprised. I mean, the mother might be 85, 90 years old, and they've never had to address these issues. So we might have to put in place a guardianship. And of course, the final answer is, how do I protect all these assets? And with a new 5-year look-back rule in Indiana and in Michigan and in every state, it's tougher.
Sure. And even in just that 45 second answer that you gave, there was a lot of language in there that someone watching at home tonight might go, oh man, I don't know anything about those things. You said power of attorney, guardianship, protecting assets, all of these things. These are things that are not necessarily going to be in everyone's vocabulary out there. You deal with them every day. So how do you go about educating people about what exactly those terms mean and what they need to know?
Well, the power of attorney and the healthcare forms are really designed for if mother, father are ill, they end up becoming incapacitated. We don't want to go to court and have a court guardianship in place. So those forms are very important. And whether you're 18 years old or 90 years old, we all need those forms.
Yeah. How tough is it these days dealing with all the various facilities that are out there? And there are numerous, I mean, especially as the baby boomers get older, we're seeing more and more people. First of all, the boomers are taking care of their parents, but there's going to come a point where all those boomers are going to be needing facilities as well. So with all of them out there, what's the regulatory environment like? I mean, is it fairly easy to go out and say, yeah, well, I found a place for mom or dad?
Well, first of all, it's getting tougher because the beds are being filled every day. I mean, as people are living longer, and these issues are coming up more and more, it's getting hard to find a facility. And your loved one might need a different type of facility, like a memory care unit. And I think that's getting more difficult to determine which facility you place your parent in, because time and time again, people come to my office and said, hey, they want to kick my dad out of this facility because he's becoming agitated, or he needs to go to Epworth, and after that, what do we do next? Nobody will take him. So these are going to be really tough issues.
It seems like another tough issue that's related to all these is how do you pay for all that?
Sure.
Because as dad needs to be moved from one place to the next, chances are he needs a higher level of care, which is going to be a lot more expense. And so people need to figure out the monetary issues that go with this as well. That's a pretty complicated area. I would imagine a lot of legal issues involved in that too.
Yeah, it's always a wake-up call when the facility tells the family that, gee, they haven't used up their 100 days, but they can no longer make progress, so they are no longer qualified for Medicare. And by the way, it's $300 per day, and that's going to be a very common payment these days.
Sure, and if you don't have the 300, you have to find someplace else.
That's right, and it's getting tougher to find Medicaid beds. So even if you're spent down below $1,500, it's tougher to find one of those beds.
Ultimately, Eric, what does somebody do? I mean, if there's not a Medicaid bed and they're caught in that trap, what happens to them?
Well, sometimes people are being transferred to a different city nearby. I mean, it's getting to be really a tough environment.
All right. Barb, you deal with a lot of issues that are related to this, and specifically with Alzheimer's and memory loss issues. Tell us a little bit about what you do and the kinds of things that you're seeing out there today.
Okay. Well, I'm with Alzheimer's and Dementia Services of Northern Indiana, and this is our 31st year in operation. We're actually the oldest social service agency of our kind in the state, and as of July 1st, we became a division of Real Services, so we're very excited about that. We serve 11 counties in Northern Indiana, and basically what we offer is disease counseling, one-on-one. We do educational programming, we do support groups, we do lending library, we do a lot of talking in the community. We're basically here to support families through that very long, arduous road of caring for somebody for 8 to 10 years plus with Alzheimer's and dementia. And there's various forms of dementia, not just Alzheimer's. I think Alzheimer's gets a lot of play, but there's vascular dementia, Lewy body dementia, and we're seeing just kind of an explosion of cases and of all age groups. We're seeing younger people with it. It's not unusual. Well, it's still thankfully a little unusual, but we're seeing sometimes 80-year-old parents caring for 40 and 50-year-old children.
With early onset
Yeah.
issues.
Yeah.
Yeah.
So,
you know, you were citing some statistics before the show got started and talking about how these numbers are increasing. About what are we looking at right now? I mean, in terms of numbers and percentages, is it really growing exponentially, or is it?
well, there's currently, they say, 5.4 million Americans with this disease, and that's a lowball estimate, and we're going to see it as much as quadruple in the next 20, 30, 40 years.
So from 4.5 million to something like 16 to 20 million.
Exactly. And so
Is that because you know, there are more things causing these types of illnesses, or is it because we're recognizing it more?
Both.
And population.
I think it's both. And I wouldn't be surprised if 10 years down the pike we've identified 3 or 4 more types of dementia, because it's very different. Everybody goes through this process in a very different way. We can see people go through it in 5 years. We can see people go through it in 18 years. But the average is about 8 to 10.
8 to 10.
And, you know, that's a long toll on families financially, as Eric works with. There's so many different phases of the disease, and one of the things we're learning an awful lot about is the earlier part of the disease process is very different than somebody who's on the road and maybe needs a facility, a memory care facility. And the folks in early dementia are really forming a very powerful advocacy voice now in saying this is what it's like to be someone with this disease process. Do not count us out. Do not tune us out. And we're really getting educated by that group of folks.
And while we're on the topic, we do have a video that we'd like to show. This is a short 3-minute video, but it talks about how Alzheimer's actually attacks the brain. It may be something that helps educate you a little bit more about how this particular type of illness makes its progress. So let's show the video.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part.
And of course, that's a rather somber video and a very frank explanation of how the disease progresses. It seems inevitable, and I know there's a lot of hope out there that's held that there will be a cure, that there will be a breakthrough. So far, limited success, obviously, and so a lot of the effort comes to trying to take care of people who are going through this. But of course, caring for aging patients is not all about dementia and Alzheimer's. There are a lot of other issues that go along with that. Dale, I want to turn to you for a second if I can. And you you still do host a radio program, a broadcast where you talk about a lot of these issues with experts and also with both parents and children who are kind of going through these kinds of things. You came up with an acronym called ADAPT. What is that and how is it applied?
I did, and ADAPT is born out of an experience I had with my aging mother. She went through a health and life crisis, and I helped her through all parts of that. It was about a 6-month process. It was very challenging, and it kind of tore our family apart, and then we came together and helped her. And I decided to create this framework to kind of emulate what I had helped my mom through. And it is a framework. It's to help adult children understand where to start when there's a crisis and how to work through the crisis, regardless of what kind of a crisis it is. There's always so many things that you have to keep in mind and work through. So the ADAPT is actually a 5-part process. Would you like me to share a little bit of it?
Yeah, ADAPT,
yes.
So there you go.
So I came up with the acronym to actually help people remember the steps. So A is for assess, and a lot of times we think the professionals do the assessment, but I tell adult children, you need to do your own assessment. You best know your parent. So you assess your parent, and you do that by observing them, by listening to them, by engaging in these critical conversations. And you try to understand their needs and their wishes and their values. And that's like the foundation right there. Then you need to assess your own capacity. So often we just put everything aside and just put everything into it to help our parent, and we disregard our own lives and our own families. And we need to partner with those professionals. The D and the A is the next part, and that's to discuss as a family. And that's when you bring your family members together along with your aging loved one and really talk through the issues and try to understand what the aging loved one wants. As much as possible, they should be involved in the decision making.
Do most aging parents, do they take part in those discussions willingly? I talk with people all the time who have a very difficult time getting mom or dad to engage in this kind of thing.
Right, so I always say start early and do it in the least directed way. So do it in a way, when I had to help my mom, I did it in a way where I gained her trust. And I sat there and she understood that I really wanted to understand what her needs were. So I think if you come from a place of understanding and love, that you're going to build that foundation of trust and open up that communication.
Okay, then what's next?
Then P is next, and P is for planning, and that's a huge part. Often when we're faced with a crisis, we have kind of a knee-jerk reaction, and we want to go into solution mode, and it's really important to plan. And if you don't plan, you'll probably end up with a solution that's not right. So have everybody together and plan out whatever the transition should be. And then T is the transition itself. And I put that in there because it's really important to know it's just not a point in time. True, usually it's a move or something like that, but you have to consider the transition really takes time after that for the person to adjust.
Okay, interesting. Does it have to be a crisis to get all this stuff moving?
It does not have to be a crisis, and it's really wonderful if you do it when you're not in time of crisis.
Sure.
So the family could come together and kind of think ahead. What are we seeing? What are some of the issues? If we think there's a memory issue, how can we best prepare for that?
So this is a helpful paradigm when there is a crisis, but it's even more effective if you start using it when there's not one.
Yes.
Okay,
absolutely.
Good advice. Donna, let me turn to you here real quick. And you're up in Cass County, and I've been up there. I've talked to your group
You
about
have, yes,
weather
great.
and things like that. You have a very active organization up there. It's interesting, as you were talking before the show, because things are maybe a little bit different in a rural setting than they are in an urban setting. Talk about that a little bit.
It is true. It's been said that Cass County is one of, if not one of the poorest in the whole lower peninsula of Michigan. We don't have any highways or freeways, no stoplights, a tiny little village downtown. We're basically a very rural community so that people can be isolated easily. The needs are different. It's harder to make contact with people and make sure that our vulnerable, frail, elderly are taken care of. The weather can change on a dime. You know that well.
Sure.
And our roads drift over in less than 20 minutes, for example. So we have to be careful and make sure that our hard services, Meals on Wheels, and are taken care of and our people are fed, so forth. But I think the diversity in culture is also a dynamic. We're 11 miles from the national grounds of the Potawatomi Nation. The Pokagon Band is close by. We have a population of Laotians and African Americans and Caucasians, very poor and very wealthy vacationing people who
Around the lakes.
Around all the many lakes of Cass County. So it's a dynamic we have to take into consideration in all of our caregiving programs and the way we approach people.
Yeah, and it sounds like from what you're saying that a lot of the effort is because there are many people who live in their own homes or being taken care of at home, as opposed to maybe in a more urban setting. You see a lot of these facilities that we're talking about. In Cass County, there aren't that many, I wouldn't think.
There aren't that many, but the ones we have are wonderful, excellent facilities. And I also think that our AAA, Area Agency on Aging Region 4 from Berrien County that serves Van Buren, Cass, and Berrien County does an excellent job. My own aging agency has a wonderful group of experts who are there and trained and well-trained in all kinds of counseling and care for people who would call in and who walk in every day.
Sure.
I wanted to add on, though, to what Dale said and what the rest of the panel members have said about aging in general, and Eric alluded to it in the beginning. It doesn't have to happen in a crisis, and we hope it doesn't, but most of the time it does. People are in the emergency room and mom or dad has just had a stroke or some kind of other event, and the adult children are saying, what now? What next?
And very difficult decisions at that point.
It is. And so we adhere to the 40-70 rule. If you're about 40 and your parents are about 70, it's time to have the conversation. And it's typically not one conversation, it's
Sure.
2 or 3,
Yep.
very comfortable in settings, recognizing they need and want their own independence and working toward giving that independence in whatever decisions you come to.
Sure, and that's kind of what Dale was alluding to as well,
Exactly.
building that level of trust.
Exactly.
We do want to get to the phones because we have people out there who have questions, and we want to answer those questions for you. And Shane is first up tonight. Shane, welcome to Ask an Expert. Go ahead with your question tonight.
Yes, thank you. My mother has dementia, and I just recently learned that we might have to possibly put her into a home. And I was wondering, how would I talk to her about that, and how would I bring it up to her?
All right, that's part of having that conversation, although as you say, this is to an extent in a crisis. We've got a diagnosis and things are moving forward. Barbara, let me start with you. Where does this begin?
Well, and that's where it gets a little tricky, because I bet we have a lot of people out there saying, okay, we can have a conversation, but if we have somebody who's on the road to dementia, they aren't necessarily seeing the issues as the family is seeing them. And that's part of the dementia, as we saw in the film, that one of the very first areas that gets attacked in the brain, in addition to short-term memory, is judgment, decision-making, reasoning. And that makes a real tough scenario for families who are saying, you know, we're going to sit down and have a logical discussion with mom, and mom says there's nothing wrong with me, and suddenly you're getting that pushback. The more you discuss it, the more mom is going the other way, because everybody is going to fight tooth and nail for their independence, and it's very threatening and frightening when you have a dementia. So we advise families to kind of look at where they are in the process of the dementia as a guidepost to how much you're going to share with that person and how logical that conversation can be. And at a certain point in the disease process, and again, if the disease has progressed, you might need to use a different approach. Instead of, Mom, you can't take care of yourself anymore, Mom, you need help. Sometimes those type of words are the red flags that will really backfire on families. So we try to say, try to use other reasons for that person to leave their home. Mom, you'll be closer to us. Mom, we'll be able to see each other more. Mom, you know how you hate shoveling in the winter time. Try to use another reason that is more an emotional or a value that you know that parent has ascribed to all their life, to make them more amenable to a moving process.
That might be a good part of the family discussion too, to talk about before you talk with mom, is to think through some of those reasons why you can present to her that it's not focused on her and something wrong with you, or it's more like you're going to like it a lot better over in this other place.
Exactly.
So, Dale, I know you've dealt with this as well quite often, and I can see you nodding your head there.
Yeah. So I think it's really important, like Barb said, to find out where they are in the disease state, to really be a part of those physician visits. That's very important. Some children don't go with their parents to the physician visits. So it's really important to be a part of that, and then to share that with the family. And then another important point when that's done is to seek out education And Barb is a great resource for that, education for the family, to really understand the disease process and to learn the options.
Sure. And Barbara, we can reach you through Real Services, is that?
Yes, and Real Services is a whole another layer for not just dementia, but they are the clearinghouse, the resource, just like in Cass County, they work with the AAA, they're the Area Agency on Aging. So they have options counseling, they have case management, they have pre-admission screening, home, nutrition. So there's a whole wide array. I would say that's the first stop. Anybody who's dealing with caring for aging parents, because it doesn't matter what the condition is, Real Services is definitely the first call they should make if they're in this 5-county area.
Right. And I hope that that might help you, Shane, in terms of having your conversation. We want to move on to our next caller. Robert is waiting on the line. Robert, good evening. Go ahead with your question tonight.
Good evening. My question is, my wife is in a nursing home. Excuse me. She has been there for about a year and a half now. She started having Alzheimer's 5 years ago. She's got to the point where her short term is totally gone. I try to visit her every other day, but it's a little drive from me, from where I'm at to where the nursing home is. And I'm wondering how often they think I should try to visit. I have tried bringing her home, but that just doesn't work. She gets into too much fear in a hurry.
Sure, that's a great question, Robert. And a lot of this gets into how difficult is it for the person who has dementia or Alzheimer's? How difficult is it for the caregiver of the person? And I know there's been a lot of discussion about that, and how much that person who has the illness actually remembers of someone who does visit and is trying to do the right thing. So much of this comes down to your emotional connections and feelings of guilt and all kinds of other things. I don't know who would like to tackle that one.
I'll just make
Donna?
one quick point. I think sometimes families have expectations for how adult children are supposed to be, taking care of their parents and visiting their parents, and cultures set certain standards for visiting and taking care of people too. And it's different for well seniors who are just aging chronologically than from someone who might not be remembering in the short term. And what you said is true too, and you all would agree that the guilt factor, whether you're there or you're not there, there's going to be guilt attached to it. And so I would encourage this gentleman to use his best judgment and work with the staff at the nursing home. Don't you think that is a fair assumption, in making sure that his wife is well physically and able to entertain the visits that he gives her?
And I agree with that completely. And I think, in general, because there is a confusion with dementia about processing time. So tomorrow could seem like a year ago, and a year ago could seem like tomorrow. But there's a lot of confusion, and so I think generally long visits are probably not really. And again, like Donna said, it depends on the person and the situation. But in general, shorter visits that are more frequent tend to work better for both parties. I think the quality is maintained that way. And also, sometimes, we advise, our families, when you're parting, make sure they're involved in something. Don't make it a "I'm leaving now, goodbye" kind of thing, because that tends to be traumatic for both parties. If you leave when they're engaged in an activity or at a meal, or slip out somewhere, but I think in general, shorter
Does that
visits.
add to the guilt, though, where you feel like you're sort of sneaking away? And and I know that you have to understand the memory on the other side. But for the person, again, for the caregiver, do you feel like you're sort of skipping out?
Well, I'll tell you, I work with such wonderful caregivers. I think we can all say, we've heard some very admirable stories, and they learn things. With dementia, the rules change on you. And it's about supporting somebody where they are emotionally, and feeding them the encouragement and the respect and showing them the love. And I think that families learn to do whatever it takes to make sure they're at peace. And sometimes those kind of things they understand is in the long run, that's better for them. Rather than putting through that trauma, I'm going home now, I'm leaving now, that can be a very traumatic time. And I think families tend to just kind of start to move with the rhythm of this disease and understand what's therapeutic.
Yeah.
And they have a shift of that.
I heard Robert mention there that it's a bit of a drive for him to get there, and so the more frequent visits might be more difficult. If you said, more frequent but shorter duration visits, that might be tough for him.
Yeah, for him.
And so let's say if there are travel difficulties involved, can he be comfortable with, let's say, less frequent visits or longer duration visits, understanding that that works better for his schedule? Is that going to be okay, do you think, for someone? Now, again, we're in a situation where this disease has progressed for about 5 years, he said. So is that going to be okay with the person on the other end? I think he's kind of looking for that reassurance.
Yeah, and again, from the wife's standpoint, she probably is not going to say, boy, it's been 5 days or 4 days since he was able to get there. I think that the caregivers need to take care of themselves because we're seeing too many caregivers pass before the person with the disease. It's extremely stressful. So I think as long as when he's there, they're having a quality visit and he's spending the time with her, that it's more about quality than quantity.
Yeah. You were talking about that statistic. I was reading one of them here that our producer had prepared beforehand, and there is a difference between, let's say, a child taking care of a parent, which is stressful, and a spouse taking care of a spouse, which is a whole different set of circumstances, really. And the statistic was that if you are a spouse taking care of a spouse, you have a 63% chance of not making it through the next 5 years because it's that stressful.
True.
Yeah. Donna, you were sort of nodding. You're familiar with this.
Yeah.
I mean, and you see this kind of thing. Very difficult for spouses.
It is, and just anecdotally, when we at one point took my father to a nursing home for some care for rehab after a major brain event, the nurses gathered around my mother instead and said, your father will be taken care of just fine. It's your mother that we're worried about, alluding to what Barb said. It is the caregiver who has the most stress in every way, physically, emotionally. I've had clients who physically fell apart. Their house started to fall down around them, so to speak. It was sort of an analogy for what was happening in their own lives, and more so for females in general than men, because females take on the heaviest kind of hands-on care more than male caregivers do. That's a whole conversation about which kind of care males give compared to females, and how it runs through families and daughters-in-law and so forth. That's a whole other conversation.
Yes, and one I'm quite familiar with. Eric, let me turn to you for a second because we want to get sort of a legal perspective on this as well. At what point, as someone is diagnosed, let's say, at what point does it become apparent? Is it immediate, right away, that you should start taking some of these legal steps before the disease progresses very far? Should you have had that conversation even before there's a diagnosis? When do things start happening here?
Well, absolutely, Gary. I mean, I and my staff have been to the hospitals, nursing facilities. We take the forms there, and we find out the person can no longer understand what what they're signing, and so we can no longer witness or notarize these documents. So it's very important if somebody thinks, gee, my loved one might have dementia, I better have these legal documents in place beforehand.
And going back to that conversation we were talking about before, if it's difficult to talk to mom or dad about we need to move you from place A to place B, I would think it's at least that difficult or more so to say, here, mom or dad, here are all these legal documents we want you to sign.
Absolutely.
Yeah. It's got to be different for every family and in every situation, but are there helpful hints that you might have about how you can best present these kinds of things and in what context that might help?
Well, getting the children involved at times is I think helpful. You'll have, let's say, a daughter lives in California, and that daughter is going to be visiting during Thanksgiving. by all means, that's probably the great time to bring their parent into the office and discuss these things. Because even though I'm an attorney, I've been doing it for a long time, it's hard for me to say, Mrs. Smith, this is good for you to sign. Whereas if the daughter is in town, Mom, you really need to sign these documents. Mm-hmm. And she will help the mother understand the documents.
All right, very good. We want to turn real quickly to another video that we have that's here. This is a video that really explores a question we haven't talked much about yet, but we'd like to get into, and those are the differences, the cultural differences that exist with different ethnicities and how different cultures view taking care of their aging parents.
I cannot imagine my life without my mother. I lived with her throughout my life, and without her devotion, we would not been here today, actually. That's how I feel. She's losing her memory, and she does not have a notion of what she's doing, you know. The other day, she asked me how many children I had. You know, when you get a question like that, oh my God, what's happening with Mom? Doctor advised me to send her to nursing home. But if I send her to nursing home, she would not get Korean meal, which is really crucial for health and sustain her life, actually. And if I send her to nursing home, she would not be able to communicate at all. So sending her to nursing home was not my option. So I tried to find the home health aide who could speak Korean and cook Korean meal, but there wasn't anybody available in Philadelphia area. 엄마의 약 잡수세요, 이거. It was really difficult. It was burden to everyone in the family. And luckily, about 3 or 4 months after, I heard somebody is coming from Connecticut who has a license. So I immediately hired her.
One, two, 위로.
In Korea, parents are usually children's responsibility. But here, the system takes care of elderly. But still, we have a guilt feeling if we don't take care of our parents.
순하자. 네. 나 같은 죄인 살리신 주내 놀라워.
It's not just my mother. Any people out there, Korean or non-Korean, doesn't matter. Really, they have very similar needs.
이거는 부르면 슬프지, 어머니.
But my mother has added need because of a language barrier and food need, cultural barrier.
Interesting video there, and of course we heard the strains of Amazing Grace in a different language, and so a little glimpse at some of the cultural differences in how people approach the concept of aging and taking care of aging parents. Donna, I have to say, at the beginning of the show you talked about the culture in Cass County, and you mentioned that there's, of course, an African-American population, a Caucasian population, a Laotian population, and the list goes on. And I would assume that you're going to find some distinct differences among those various ethnicities as you're working with aging issues.
You know, there are differences in the way people give care depending on birth order. And I already said whether they're male or female. And we found in working with the wonderful Potawatomi Nation, their generosity and revere and honor for their parents, so that when you talk about caregiving and what it means to be a caregiver, it's very natural to them and it's just part of who they are and what they do. So they don't think of themselves as caregivers. It's just what we do. Those are my parents. And it's hard sometimes to cross that barrier and talk to them, explaining the clinical parts of caregiving, because it's just something they do. And I would say that a lot of European cultures too have had people who are Hungarian and Czechoslovakian, Eastern Russian in different classes, caregiving classes, and they all say the same thing. It's who we are. It's not care. It's who we are. And they don't understand it as a job.
Mm-hmm. At the same time, they must all have, as you heard in the video, we all have similar needs. And anybody can address this. No matter what culture you come from, you reach a point perhaps on that medical spectrum, in the case of Alzheimer's or other kinds of diseases, where you're dealing with things that are beyond your control, beyond your ability to actually handle at home. And so how do you have those types of conversations? Again, I think it would be different from one culture to the next, where some are more embracing of the technologies and the other things that are out there. So, Dale, I mean, you want to?
Well, I always say to families when they do reach that point where they need to place their loved one in an assisted living or a nursing home, don't feel that you failed. Mm-hmm. Feel that you are reaching out for the best kind of resource available to your family. And when we have families come in, we feel they're an integral part of the care and the support that we're offering their loved ones. They are a key part of our team. We can't do our job without them. In fact, in our memory care assisted living, one of the first things we do is get a complete resident life history of the resident. We want to know everything about who they were and who they are. And that way we can relate to them, engage them, and we can be a part of that family. We're an extended family. Mm-hmm. That's how we look at it.
Sure, sure. Let me toss a question out here too, because inevitably this comes up, Eric, or it may fall more in your line, but anybody can answer too, and that is about the expense that's involved. How do we pay for it? How are we going to do that? It's one thing to say that we need to move mom or dad or a spouse to a facility, and as you mentioned, it's not a sign of failure. We just need, this kind of care. But needing that kind of level of care, there are a lot of expenses that go along with that. This is not cheap, and it's not always covered. In fact, very often it's not covered by the types of insurance that people might have out there in programs. So how do we deal with those kinds of financial issues that will inevitably come up when you start talking about having to go to a long-term care situation?
Well, it's very expensive. The good news is there are a lot of, like Dale said, assisted living, memory care units that are popping up everywhere. And I think they see the baby boomers, coming along, and so there's a much greater population of need. But I've seen people that end up in a facility, a nursing facility for the 100 days. They're rehabbed, and then they can move into an independent living situation that might be $2,000 a month. Assisted living might be $4,000, $5,000, $6,000 a month. But nursing facilities are now $8,000, $9,000, and $10,000 a month, and even more. So I think there are a lot of options out there. There are even some people that have private homes that have 6 people or less. Those don't have to be regulated. And a lot of people say, gee, they're not regulated. Yeah, but they only have 6 people in there, and they have to have 24-hour care. So those facilities are somewhere between $3,000 and $4,000 a month. So there are some options out there. There's also the aid and attendant benefit through VA. So if your loved one, parent have either been in the military during a foreign war, or their spouse, they can qualify for sometimes up to $2,000 for VA benefits each month.
Mm-hmm. But again, there are limits to that, so that when they hit that, when they need that next level of care, that's no longer going to do it. Right?
Sure. I mean, if you have income coming in, even with the VA benefit of $3,000 a month, you're right, you can't pay for $10,000 a month.
Yeah. So, Barbara, this is, in terms of specialized care, memory issues and things of that sort, this has to be very much on the mind. Again, raising the stress level probably for those who are trying to be the caregivers.
Well, and I do want to point out too that again, dementia is a long process of stages, and there's a lot of care before residential care. We run an adult day center, Milton Adult Day, here in downtown South Bend. Day center has reached, it used to be even 10 years ago, people didn't know much about day centers. That's a very valid form of care to provide families a break, a real break throughout the week, and stimulate people appropriately with this disease process. Families can make an enormous difference by learning as much as they can about dementia to the quality of life that their loved one is going to get through the process of the disease. And I think when Dale talks about being proactive, that's really key, because it's been my experience most people wait, and Donna alluded, it's in crisis. Most of us wait too long to make a decision, to just kind of push it a little farther. And the earlier you get people used to day centers, get used to home health agencies, different respite services along the way, they tend to do better going to a facility because they're more used to seeing other people and have people involved in their care. Sure. So, and there are a lot of options to help families afford some home care. Real Services and all area agencies across the country have grants that families can apply for, Medicaid waiver. They have the Older Americans Act and choice programs and social services block grants. There's some grants that families can tap into to get some respite and get some home care. And that's why it's really a first stop shop to get with your area agency on aging to see what you might qualify for. Sure. And the veterans, as Eric mentioned, are a great source of help.
And it seems like a lot of people don't know about that program, even though they would probably qualify for it. So education again. Dale, let me ask you, based on what Barbara was saying, does it take someone, because all these things, being proactive and making decisions early and all that kind of thing, it seems to me it takes in any given family what might be described as someone who has to be sort of the catalyst. I mean, somebody's got to overcome these barriers of whether it's a comfort level of being able to talk about these kinds of things, whatever it is. And from your experience, I don't know everything about your background, but it strikes me as you were kind of that catalytic person.
I was.
So what does it take to do that? Was that difficult for you, or did it just sort of a natural thing?
When it happened to me, I had no idea what was happening. I felt like I was just spinning. I didn't have this background at that time. I think that there's always one person in the family that's going to emerge as the primary caregiver and kind of pull the family together. I see it with families I talk to every day. And it's kind of interesting. Donna and I were talking, it's usually the daughter or the daughter-in-law.
And were you the only daughter?
I was the only daughter, and my brother happened to be away on vacation and unavailable when the crisis happened.
Okay.
And so it's just you step forward, your loved one needs you, and it's really interesting. We haven't touched on this fact. Caregiving can be very challenging. I mean, I went through nights of tears and not knowing which way to turn, but I tell you, in the end, it was one of the most positive experiences of my life. My relationship with my mother grew to a depth that I had no idea it ever could. I never expected to have that quality of relationship with her. So it can be one of the most positive growth type of experiences a person can have.
Sure. But to make those, now as yours came in a crisis, but to make those decisions and to have those conversations, you have to overcome maybe some comfort barriers for a lot of people to be able to broach those conversations, both with your parent and perhaps with your brother, your other family members.
My brother, absolutely. It's hard. It's really hard. I will say there are some professionals out there to help us. I had to end up hiring a geriatric care manager for my mom. I'm a long-distance caregiver. There are mediators to help families get together and really work through these issues when there's differences of opinion. So
all right, we want to get back to the phones here if I can, because Ray just popped on the line. We want to make sure we get to his question. Ray, go ahead.
My name is Ray, and what my question is, I'm 89 years old, 3 more months and I'll be 90. I live by myself. And I want to know if I know there's things that happen to me that I can see this coming along, but I seem to manage so far. I only think if I don't, my daughter only lives a short distance away, and she will come over and help me. But are there anything that I can do to make this siege of dementia or whatever it is coming on? Can I slow it down any so it takes longer?
All right, Ray, let me quickly ask you, have you actually been diagnosed with some form of dementia?
No, I'm not. I have not been.
Okay.
I just know there's things that I forget and can't find and this and that, or if the TV goes blink and I can't get it back on, I call my daughter and she'll come over. I push the wrong button and black things out or something.
Mm-hmm.
I do that and it looks like you should be able to get that yourself, but I didn't.
All right. Well, let's first ask our experts, because this is important actually, Ray. It's important to know whether this is actually dementia or just the natural process of aging. I lose things and forget things I didn't used to. And so let me ask our experts, how do you know the difference between that sort of natural process of aging and what's actually dementia?
Okay. Well, you know, I think Ray, it's great that he's very proactive about it and kind of confronting what his changes are. So I applaud that. And it's very important to get it diagnosed, because there's many reasons why our memory changes. We do have normal changes as we age, and those are, we do have a legitimate slowdown of short-term memory. We do have a legitimate where we can't lay our hands on words quick enough, where we walk into a room and don't remember what we came in there for. Those are kind of normal things that happen to all of us. And they're not to be confused with a dementia, which actually means problems with thinking, reasoning, and remembering that's so severe that a person is having trouble keeping up their day-to-day routine. If memory has reached that point, then we say you should get it checked out, because it could be one of an array of something that's treatable. And there's over 120 conditions that cause symptoms of dementia. And some are very straightforward. It could be a thyroid problem that hasn't been picked up. It could be low B12. It could be elevated or calcium or low potassium. It could be a urinary tract infection. It could be meds. It could be depression. So it goes on and on and on. So dementia is diagnosed by ruling out all those types of things that do show up in blood tests, in CT scans, in MRIs. And so I would encourage Ray to get be sure that this is what he's dealing with and it's not something treatable.
And Eric, at the age of 89, almost 90, are there things that Ray should be doing right now?
I've got a whole list of things, Ray, you can be doing, but number one, it doesn't sound like he has dementia right now. I think as an 89-year-old, Ray, you sound great. I would encourage him, if you live alone, definitely have Lifeline. I can't believe how many people don't have it when they live alone, even though the daughter's nearby. Make sure you don't have rugs that you're going to trip over. Make sure you don't have a washing machine down in the basement that you're running down there. Make sure that you have your eyes checked. Make sure it's okay that you're still driving. Have your daughter drive with you and see if it's okay. I mean, these are things that not only for you, but for other people's safety.
Sure. And in terms of legal things, he talks with his daughter. Are there things that they should be working on right now that Ray should maybe be thinking about?
Well, yeah. I mean, you could look. I mean, is your daughter on your deed? Do you want her to have your house? Is she on your bank accounts? I mean, these are really important things.
All right. So we want to take care of all those. Dale, you've been in that close relationship. This was, in this case, father-daughter as opposed to mother-daughter. Recommendations?
Well, I think Ray just has a really great sense of life talking to him. I would say the daughter should, and this is what I didn't do initially for my mom, the daughter should also know Ray's neighbors, just in case she can't be there. When my mom had her health and life crisis, her best friend did not have my name or phone number as my mother was being put in the ambulance to go to the hospital. So I'd say make sure that she knows Ray's neighbors and they know her.
Sure, and be able to communicate, get in touch with it. Donna, let me turn to you then. I mean, in the situations that you see, I mean, this is fairly typical now, but you've got a guy who's really sort of thinking this through at almost 90 years old.
And we see and talk to people like Ray every day. He sounds wonderful, and he's aging very well. And you know, we've talked a lot about Alzheimer's tonight and dementia, but it's important to note that of the population, it's still just a very small percentage of people who have that disease. And the people who are aging normally and getting old and just becoming frail and need to have conversations about breaking up housekeeping or when to give up the car keys, like Eric talked about, or how to divide the stuff, and how to talk to doctors and get the important papers in place, is all part of it. So Ray can do that. Ray can do that right now and make sure that he has everything in place, see an attorney, see an elder attorney like Eric, and make sure that his daughter knows where all the papers are. Lots of times older adults have insurance policies, little bits of pieces all over the house, stuck in the legs of hunting pants, and children need to know where all the papers are, all the
some
medications,
organization, huh?
all of that,
All right.
organization.
All great advice. Well, thanks very much, Ray. And unfortunately, the hour has flown by. Again, we're out of time. I know that's hard to believe, but thanks very much for being our last caller there and asking such a great question. Thanks to our experts for being here tonight, and we look for more conversations about caring for aging parents on our website and on Ask an Expert at WNIT.org. You can always go there and check out the program. Next week, we'll be talking about living with the disease of diabetes. I'm Gary Sieber. We'll see you next week right here on Ask an Expert. Good night.
This WNIT local production has been made possible in part by viewers like you. Thank you.